Whatever all of us are flushing down the toilet is now coming out the other side helping scientists. Wastewater testing wasn't just a pandemic thing. Your sewage is still being used as a gauge for public health. Now flushing is helping track the flu. Our Evan Krugel found out why.
A hot, steamy shower is a daily occurrence for thousands of Coloradans. But most don't think twice about where that water ends up.
I think there's a lot of potential for wastewater surveillance, and we're really at the very beginning of trying to understand how to use this data.
Dr. Rachel Herlihy and the state's health department have been tracking COVID-19 levels in wastewater for more than 3 years. Now they're using the same technology to test for influenza and RSV.
Because wastewater data doesn't rely on an individual seeking health care for us to gather that information. So it's a nice augment to the other routine work that we're doing in public health.
Dr. Herlihy says water from showers, sinks, even sprinkler systems ends up in the sewer before being tested at local water treatment plants. 20 of those utilities are now testing the water for viruses before sending the information to the state. Data from the first flu season closely matches hospitalization data, but Dr. Herlihy says the wastewater testing is coming in faster.
The promise of wastewater surveillance is that it has the ability to start identifying that virus sooner, as soon as that person starts shedding it.
The state is now posting that data on an online dashboard where people can search specific watersheds to see COVID, flu, and RSV levels in their area. And while she understands some may find this to feel like Big Brother, the state isn't tracking who specifically is sick or where.
We are not doing work in Colorado at an individual building or school or hospital or households. This is really at a large community level.
Now, this testing only works for homes on sewer systems. So if you live in a rural area or if you have a septic tank, you obviously are not included in this. But the state estimates it is testing about half of the state's population right now. And Mark, they're looking into what additional viruses they could potentially add into this repertoire to test for in the future.
I remember when we started learning about this during the pandemic, it's just absolutely fascinating to me. Can they determine if your house, can they test down to specific houses to determine, are you sick, or is your neighbor sick? Like, how specific can it be?
That's one of the big limitations with this, because they're collecting such a large pool of samples by the time it actually reaches a wastewater treatment plant. It's hard to know exactly how many people in any given community are actually sick with that virus. That's one of the big limitations here, but they say they want folks to look at the overall trend of data in an area. So when you look at your specific watershed, look at the trend over time instead of specific numbers. That'll give you a better idea of whether there's large spread in your community or not.
And the trends are still super helpful. I remember, like, during the pandemic, they could determine whether, like, a specific dorm at CU, for example, had an elevated COVID rate and all those. Super interesting. Evan Krugel, thank you.